Hello, I'm Dr. Beth Godey.
And I'm Dr. Martha Leatherman. I'm a geriatric specialist in psychiatry.
And I'm a neuropsychologist, and I specialize in aging.
We're experts in dementia care, and we're here to provide you some information and answer some questions that we hear very commonly about dementia and other issues in aging.
Hi, well, we're here today in Fargo, North Dakota. We're in a very pretty site with a lovely tree behind us. But today's topic is unfortunately a very serious topic. We want to talk to you about suicide in elders. And one of the things that people don't realize is that suicide is much more prevalent in elders than you might expect. In fact, the statistics show that suicide in elders is more common than in younger people.
Especially completed suicide. And for men, as they get older, the risk of suicide actually increases. So from 65 to 85, and then from 85 and older,
Yes.
the prevalence of suicide actually goes up in elders, which is a horrible thing to think of, living all of your life, providing for families, providing for children and grandchildren, leaving businesses and professional lives, and then to end in suicide and the pain that causes people.
There's a few red flags that can come up. We do know some signs that may help predict that someone might be thinking of suicide. The first, of course, the most obvious, is depression.
Depression is a huge risk factor, and one of the misconceptions about suicide is that somebody who commits suicide wants to die. That's less often the case. What the person who commits suicide is thinking more often is that they can't stand to live. And there's a difference between wanting to die and not being able to continue to live. So that things are so bad in life that as bad as death is, it's better than to continue to live. And that's usually the mindset of somebody with suicidal thoughts or plans.
That's true. And people who are depressed do have thoughts like that. But with the depression can come social isolation.
Big risk factor.
Because the depression keeps you from maintaining your activities and your social contacts.
And then I call it the depression glasses. You start feeling like nobody wants to be around you, that you're such a bad, worthless person, when in fact it's the depression making you isolate, and other people don't know how to help you, and so it becomes a cycle, and you're alone and there's nobody to talk to, and you think suicide.
Yeah, and people can feel pretty worthless, especially older people who think their lives are over, they have nothing really to live for, and they actually do. But again, those are the depression glasses that they're viewing their lives through.
Yes, the idea of despair and suicide is an important one. There's a difference between sad, or grief, and despair, hopelessness. There's no reason to go on. There's nothing for me here. So when you start hearing the despair in somebody's voice, it's a red flag for suicide.
It really is. And this can happen not just in older people who live alone in their home. Suicide can happen in retirement communities where you might expect someone, well, how can you be alone if you're in a community where there are lots of activities and other people around? But it can definitely happen anywhere.
Because we all know that you can be lonely in a crowd. You don't have to be alone to be lonely. And it's the loneliness that, again, the despair, the loneliness, the hopelessness, the isolation, along with physical problems. If people think that they have only a life of pain to look forward to, if they are in physical pain, if they are looking at increasing debility, they may think that the best alternative is to kill themselves because it's not worth living with the kind of physical pain and debility they may have.
That's right. In fact, in nursing homes where suicides occur, they found that there has been an increase in physical illnesses or a worsening of physical illnesses that can be a predictor of suicide, and the pain goes along.
The pain
with
goes
that,
with it,
and the feelings of hopelessness.
And with the physical problems, large majority of people, elders who commit suicide, have seen a physician within a month of the suicide.
Right.
And I must say that all too often it's easy for healthcare providers and physicians to dismiss the concern over suicide because you think of it in a different population. You're not thinking of it in elders. But in elderly men, the intent can be greater, and that's an important consideration, and the lethality, the means of committing suicide, the two most common means being hanging and gunshots.
That's exactly right. We bring this up not to actually just to bring it to the forefront, because nobody seems to want to talk about this, and especially depression. Older people, there's such a stigma to depression that they don't really want to talk about things.
And sometimes they don't recognize it.
That's exactly right. So we would encourage you that if you're feeling depressed, or you're feeling like you've lost interest and you've started to withdraw from things, please get some help. Talk to your family, talk to your friends, talk to your doctor about that specifically. And we really would like for people to become more aware of the signs of this.
If you have a loved one and you're concerned about suicide in the loved one, don't blow it off. Take it seriously.
Right.
We have up here on the screen the number for the 1-800-SUICIDE hotline, and in every community there are suicide assistance programs available. For more answers to questions like these, our book, The Insider's Guide to Dementia Care, is available at Amazon.com.